Welcome to the EdDevelop channel. Do you ever wonder what are the most common fears in the world? It turns out that there are quite a few of them, and they can range from the seemingly insignificant to the downright terrifying. In this video, we'll be exploring the top 6 most common phobias in the world. From arachnophobia to acrophobia, these phobias can affect people from all walks of life and can range in severity. So, if you're curious about the top 6 most common phobias in the world, keep watching to find out more. Phobias are an irrational fear of something. The most common phobias range from being afraid of spiders, heights, and open spaces, to being scared of dogs, thunder and lightning, and flying. While these phobias may seem silly or even funny to some, they can be debilitating for others. It's important to understand what a phobia is, as well as to know the top 6 most common phobias in the world. In this video, we'll explore the 6 most common phobias and how to manage them. So let's dive in and learn about the world's most common phobias. If you like this content, don't forget to subscribe, leave a like, and activate the bell to receive future updates from us. If you want to actively contribute to the growth of the channel, keep in mind our Patreon. Find the link in the description. Arachnophobia, the fear of spiders. Arachnophobia, or the fear of spiders, is one of the most common phobias in the world. It is estimated that more than 50% of people are at least a little scared of spiders. The fear of spiders can range from slight unease to paralyzing dread. When faced with spiders, people with arachnophobia may experience a range of symptoms, including trembling, heart palpitations, shortness of breath, sweating, nausea, and an overwhelming urge to escape. Some people may even experience a full-blown panic attack. It's not entirely clear why some people have such a strong fear of spiders, but it's thought to be linked to our evolutionary history. Spiders can be dangerous predators, so humans may have evolved to be wary of them. Although arachnophobia can be disabling, there are treatments available. Cognitive behavioral therapy, CBT, is particularly effective in helping people to overcome their fear of spiders. In this type of therapy, people are gradually exposed to spiders in a safe, controlled environment and are taught coping skills and relaxation techniques. With the help of a trained therapist, many people can eventually learn to manage their fear and be comfortable around spiders. Ophidiophobia, the fear of snakes. For those who suffer from ophidiophobia, the mere sight of a snake can bring on immense anxiety. Some sufferers report feelings of terror and panic, even when they're nowhere near a snake. Ophidiophobia is one of the most common phobias in the world, especially among children. Ophidiophobia may be caused by a range of factors, such as previous traumatic experiences with snakes or negative messages and stories heard about them. It can also be linked to other fears, such as an irrational fear of insects and animals. Unfortunately, many people have never had the chance to interact with a snake and may have only experienced them through books or television. If a person has no positive experience with snakes, this fear could likely manifest. It's important to remember that snakes are not inherently dangerous and can even be beneficial to us. For example, they can help keep rodent populations under control, so it's important to keep an open mind about them. Acrophobia, the fear of heights. Acrophobia, also known as the fear of heights, is one of the most common phobias in the world. It affects people of all ages and can range from mild fear to extreme fear. People with acrophobia experience feelings of panic, dizziness, and nausea when exposed to heights, even if it's just standing on a ladder. For some people, their fear can become so severe that it prevents them from participating in activities like mountain climbing or skydiving. The cause of acrophobia is not well understood, but some experts believe it is related to evolutionary processes that helped humans survive in the wild. The fear of falling from heights is a natural response, which may be why some people develop an irrational fear of heights despite never having a traumatic experience with them. To overcome acrophobia, some experts suggest cognitive behavioral therapy, CBT. This type of therapy helps people to identify their fear triggers and then helps them to reframe the experience in their minds. Gradual exposure to heights can also help people slowly build confidence in their ability to handle heights. With the right treatment and supports, agoraphobics can learn to cope with their fear and eventually overcome it. Agoraphobia, the fear of open spaces. Agoraphobia is a type of anxiety disorder characterized by a fear of open or public places. People with agoraphobia feel that they can't escape from these places, leading to an intense sense of panic and discomfort. Symptoms of agoraphobia may include dizziness, trembling, nausea, shortness of breath, sweating, difficulty breathing, and a racing heart. People who suffer from agoraphobia often find it difficult to leave their homes or go out in public due to overwhelming feelings of fear and anxiety. It can be very debilitating as it affects people's ability to work, socialize, and even do everyday tasks. The cause of agoraphobia is not known, but it is thought to be related to a combination of biological, psychological, and environmental factors. Those who have a history of trauma, such as physical or sexual abuse, are more likely to experience agoraphobia. Additionally, having a family history of anxiety disorders or major depression can increase one's risk for agoraphobia. Agoraphobia can be a very disabling disorder, but with proper treatment and support, people with this condition can learn to manage their symptoms and lead a normal life. Cynophobia, the fear of dogs. Cynophobia, or the fear of dogs, is one of the most common phobias in the world. It affects people of all ages, though it can be more common in children due to their lack of experience around animals. People with cynophobia often avoid going out and interacting with other people and can even be afraid to leave their homes due to their fear of being confronted by a dog. There are several possible causes for cynophobia, including a traumatic experience with a dog, being exposed to negative messages about dogs from family or friends, or even just seeing an aggressive-looking dog. Those who suffer from this phobia may feel overwhelmed when in the presence of a dog, experiencing symptoms such as an increased heart rate, sweating, and difficulty breathing. If you or someone you know suffers from cynophobia, there are a few steps that can be taken to help cope with this fear. It is important to remember that there are no quick fixes and that it will take time and patience to overcome the fear. One of the best ways to start is by gradually exposing yourself to dogs in controlled environments. For example, if you know someone who has a friendly, well-behaved dog, you could start by asking to pet it while it is on a leash. You could also spend time around dogs at pet stores, or even ask your doctor for advice on how to gradually expose yourself to dogs in a safe way. It is important to remember that cynophobia is a real fear that needs to be taken seriously. If you or someone you know suffers from this phobia, it is important to seek professional help from a qualified therapist. With the right kind of help and support, those who suffer from cynophobia can learn how to manage their fear and eventually conquer it. Mysophobia, the fear of germs and contamination. Mysophobia, also known as germophobia, is a type of specific phobia characterized by an excessive or irrational fear of germs and contamination. People with mysophobia may experience intense anxiety and panic when they come into contact with germs or dirty surfaces, or when they think they might have been exposed to germs. This fear can significantly impact their daily lives, making it difficult for them to leave their homes, shake hands with others, or even touch everyday objects. Mysophobia can manifest in different ways, but common symptoms include excessive hand washing, avoiding touching or shaking hands with others, avoiding public places, and constantly cleaning or sanitizing surfaces. In severe cases, mysophobia can lead to agoraphobia, a fear of leaving one's home. The cause of mysophobia is not entirely understood, but it is believed to be a combination of genetic, environmental, and psychological factors. Some researchers suggest that mysophobia may be linked to a traumatic event, such as a serious illness or a loved one's death from an infectious disease. Phobias are common mental health issues that affect many people worldwide. The most common phobias include a fear of heights, fear of enclosed spaces, fear of social situations, and a fear of spiders and insects. These phobias can have a significant impact on an individual's daily life and can be treated through therapy and medication. It's important to note that phobias are not simply a fear of something, but a persistent and excessive fear that can be debilitating. Understanding and addressing phobias can greatly improve the quality of life for those who suffer from them. That is all for today's video. I hope you enjoyed it. And you? Do you have a phobia or a seemingly unjustified fear? Subscribe for more content like this and hit the like button. Also, leave a comment if you have a topic you want us to cover. Until next time, take care.